But we will get through this. So all of us have a role to play. All of the decisions that each of us make contributes to either spreading the virus or contributes to limiting that spread. And so we need to think about everything that we do every day to be on the side of that equation of limiting the spread of the virus.
Thank you very much, Maria. There is a follow-up question from one of our viewers. Speaking of winter season in Northern Hemisphere, is WHO considering some new and effective methods to fight COVID-19? So do we have any fine-tunings depending on where we are at the moment and the weather season that we are facing?
Yes, we are always fine-tuning our guidance. And I really like that word, fine-tuning, because and as you've heard us talk a lot about the science of this virus, we didn't know anything about this virus a year ago. It's pretty incredible. It's astounding, actually, how much we've learned and how we have applied that science, that data, that evidence into guidance. So we're always fine-tuning that. We published today or yesterday updated guidance on mask use, for example. And this is an example of fine-tuning guidance over the last year. And we have issued updates on that, of looking at the use of masks as part of a comprehensive package. It's one tool of many that can be used to help prevent the spread of COVID-19. But again, it has to be worn safely. It has to be combined with good hand hygiene before you put it on and after you take it off. And yes, we have fine-tuned that. I think a lot of people are looking for the shiny new object, the next innovation, the next thing. But I think what we need to try to find a way is making all of these existing tools really exciting again, because these are really powerful tools we have now. The vaccine will be another powerful tool that we have, but we did issue some updated guidance on masks yesterday.
Thank you, Maria. Some viewers are asking why we are not wearing masks. So maybe you can explain again, and as well, what do we need to do more when we are spending time indoors? And I think some of the viewers were asking, what are the riskiest settings during winter that I should avoid?
Yeah, so there are riskier settings, than others. And if the virus is circulating in your community, because again, the global situation is not the same. So in areas where the virus is circulating, the virus spreads most efficiently between people who are in close contact with one another, and especially in indoor settings where you have poor ventilation. And you've heard us talk about this before. This is a respiratory virus, and the virus can be released from me when I'm talking, when I'm singing, if I cough, if I sneeze, and it can pass through the air from me to you, and especially if we're in close contact with one another. And the particles are a different size. The droplets are different size. The bigger ones are called droplets, and the smaller ones are called aerosols. And that can pass, and the virus, if they're in those, can pass from me to you. If you're in an indoor setting that has poor ventilation, the possibility of these aerosols generating and building up is higher. And so it can become airborne in those type of situations. And it behaves opportunistically. It takes the virus in these it takes advantage of that type of situation. So that's why we say open a window, and improve the natural ventilation in that space. First of all, avoid it if you can in the first place. But in our new guidance for masks, for example, that I just mentioned, one of the new recommendations, updated recommendations, is if you're in an indoor setting and you don't know if the ventilation is good, wear a mask. Put on a mask until you know there's good ventilation. This includes public settings, so if you're in a shop and you don't know, wear a mask. If you visit somebody's house that's not your own house, and if you're with people who are outside of your immediate family, wear a mask. And again, this is mainly for source control, because if we don't know if I'm infected and I'm feeling fine, we know the virus can spread from people who are asymptomatic, which means they don't develop symptoms, or they have not yet developed symptoms. So it's important to wear a mask for that source control. But in the first place, if you can, avoid risky settings, indoor, crowded spaces for long periods of time where there's poor ventilation. The virus really likes that type of setting.
Thank you, Maria.
And we all know those settings. Have you ever sat in a room and think, well, this place is very stuffy?
Yeah. Yeah.
If you're in a room and you think it's stuffy and there's a bunch of people in the room, that is just not the place to be.
Yeah.
And in a room when you feel there's ventilation, I can hear our ventilation here, and I can actually feel the airflow because it's pulling the air upwards from behind me here.
You can see
and
it
I can
behind
feel
you in
the
there,
actual
yeah.
airflow and the thing. So we know there's a good airflow here. And
We're more
because
than
of that,
enough.
we have our masks here in our little bags. I walked in here with a mask because I was in the common area. So what we're trying to do at WHO is do risk management through the whole cycle of the day. And we look at the day, and our days are unfortunately a lot longer than 8 hours. So what we're trying to do all the time is, for example, even myself and Maria, if I've got 8 o'clock morning, we have our health ops meeting. Well, many of us will actually do that from off-site,
Right.
because we don't want to pack into the room. So we only have because I actually don't necessarily attend that meeting because I'm not central to that meeting, but I need to know what's going on. So rather than be in the room, I dial in by Zoom into the meeting. I get all the information I need, but I'm not exposing anyone. I'm not exposed myself. In my office, well, I'm a pretty large office now. It's a big place. But my rule in my office is both windows are open, which means it's freezing. And the maximum number of people in my office is me plus 2 or 3 maximum others. So we've taken the chairs out of the room, so it's not possible to have more people sitting down. So we're doing the same stuff,
Yeah.
and it's just as annoying as it is for me as it is for all of you. Because you think, and then if I want to have a meeting with 4 people, I've got to organize a big meeting room because it's more than the 3. But that's the way we manage those. And for example, there are smaller modules here, single office modules, and our rule is nobody can have a meeting in those rooms. Only one person can be in those rooms. So everyone is adapting, and we've had to evolve that advice over time. Now, if you think about that for yourself in your day, it's the same thing. It's about, I've said it, if you're coming up to Christmas and the normal, or Thanksgiving that's just gone, and there's 14 people in the kitchen all preparing dinner, that's not safe.
Right.
So it may be that mom or dad needs to take control and have people doing parts of the kitchen chores in other rooms. So it is about breaking it down and seeing what's safe. Maria said it, the distance is key. The number of people in the space, the amount of time you're in that space, the ventilation in that space. What a mask does is it effectively gives you virtual distance. By wearing a mask, you're actually almost, the person who's closer to you is virtually further away, because less of their droplets or less of their aerosols can reach you because you're protected and your droplets aren't reaching other people. So in effect, you're creating a virtual extra distance between you and that other person. The other thing you could think of is if you imagine yourself as a sort of a sponge. I would hate to put the analogy as a viral sponge, but in a sense, everyone to get sick needs a certain minimum number of viruses to be exposed to in a given period of time. It's not usually one virus that infects you. So you need this sort of concept of saturation or an infectious dose that you need to get. So if you think about it, there's some critical number that we don't know, but we know that if you're in a room with lots of people over lots of time with poor ventilation and you're not wearing a mask, you're going to get relatively exposed to more virus. In other words, your body absorbs more virus in that time and in that place. If you can keep your level of saturation with the virus below a certain level, then your chance of becoming infected with a low level of exposure to the virus is much, much lower. And it's about keeping your individual risk below some level. If you imagine trying to play a computer game, if you're trying to keep the cursor below a certain point and trying to, and if you look at every activity you do in your life, it will either increase your risk of having a significant exposure or decrease. So if I'm going to the shop and I decide I'm going at 6 o'clock in the evening when everyone shops after work, then my risk is going to go up because there's going to be 60 people in the store. But if I decide to go to the store at 9:30 or at 10 o'clock in the morning, then maybe there's only 5 people in the store. My risk goes down. So the same activity can have a different risk profile depending on when you do it and where you do it. Yeah. And I think people just need to sit down and work through those issues. Because you keep your risk below a certain level, you don't infect anyone else, they don't infect you, the numbers drop. Yeah. And all these lockdowns are doing is effectively imposing that on people.
It's quarantine for everyone.
It's quarantine for everyone.
Instead of quarantine for some.
And what we need to do as we come out of these lockdowns and quarantines, community quarantines, as we come out of them, we have to follow through.
Yeah.
And we need to follow through on those behaviours that keep the risk low, without swinging and springing back in to the high levels of transmission that require lockdowns. And people need to realise that we're not going to have sufficient vaccination in place to prevent another surge of cases for at least another 3 to 6 months. That's the fact. So those countries now that are winning the battle and getting the numbers down, everyone needs to realise that those numbers will not stay down unless we keep doing the smart things. Those numbers will bounce back up, and we'll have another wave before we get to vaccine, and more people will die and more health workers will become exhausted. So I think I'm actually more and more hopeful, because I'm actually seeing each time we seem to go through this, people are getting it more and more. People are seeing the benefit of actually following through on those activities. And I would say as well, we don't want to make this purely about individuals. I mean, and people's behaviour. We say the riskiest settings. The government and private sector and others have responsibilities to make those settings safer too. It's not just my responsibility. Disinfection on public transport, limiting the number of seats available on public transport, blanking out seats. There are things that the government does and the private sector does that help us
Allow people
or
to
hinder
telework.
us, right?
Yeah.
And we can be hindered by the government, or we can be helped into doing the right things. And we need that help and support. And thirdly, we better not forget that we keep needing to do testing for this virus, strategic testing. We need to increase testing. We need to increase our surveillance. And ultimately, if we can identify a higher proportion of the cases and we can quarantine all of those contacts, then the risk levels at community level go down significantly. So we need to keep all of those activities up while now planning for vaccination. So we need to, this is juggling now, this is juggling for experts, because we've got, public health surveillance, and we've got personal behavior, now vaccines, and we got to do this for the next 6 months. And it's not easy. Maintaining all of that activity at government level, at science level, at community level, doing that together, we finish this, and that's the prize. Who wants to get back to work? Who wants to get back to school? Who wants to get back to living your lives as you knew them before? That is possible now, given what we've learned about the virus, given the advent of vaccines, given what governments can do and have been shown to do in terms of being effective. So I'm going into this coming holiday period with great hope, great sadness for what's been lost, and for those families who've lost loved ones, with huge sorrow in my heart for that. But with a great hope that we've learned enough to do much better, and to finish this. But it won't finish by itself. This virus doesn't just go away.
No.
We make it go away.
Thank you, Mike. There are a lot of follow-up questions. I think I'll read a few on masks. One is, what about different types of masks that exist? Does the one with valves works better? And there is another one, do we still need to wear a mask after getting vaccinated?
That's a good question. Yes, so there are a lot of masks that are out there, and in fact, in the guidance that we have, we've updated our recommendations on how fabric masks, non-medical masks, can be worn. Actually, that's a very exciting area of innovation. At the beginning of this pandemic, we had very little information, if any, on non-medical masks. And we've seen an explosion in terms of research that's looked at the different layers and the different types of fabrics, making sure that it still provides the same type of source control with a filtration layer in the middle, which fabrics help with breathability. So there's a lot of really good innovation and research that's out there. We don't recommend masks with valves because if you have that valve in there, it allows air to go through, and it defeats the whole purpose of the mask itself. So we recommend medical masks for health workers, for people who are sick themselves, and people who are caring for those who are sick. And we recommend non-medical masks or fabric masks that have at least 3 layers and have a filtration layer in the middle for everyone else. And again, what we're trying to do with masks is add this as a tool, as one of many that can be used where the virus is circulating. Many people want to know, why don't you just say everybody wear a mask all the time? Well, it's contextual. It's really important that we wear them where appropriate so that it helps the spread. And so there's a lot of locations where that is, and it's outlined in the guidance itself. So there's fabric masks or non-medical masks, and there's medical masks themselves. The respirators are not actually a mask, they're actually called respirators. Those are for medical professionals who are carrying out certain types of medical procedures, who are in ICUs, carrying out, or where there are these aerosol generating procedures that are done on patients. And we recommend respirators for those medical professionals. But I do want to highlight one thing. I mean, the world has really stepped up and increased production of personal protective equipment and masks in particular, but we have not solved the problem. There still are shortages of masks. It has improved greatly since the beginning of this pandemic, where we had a complete market failure on this, but it isn't completely solved. So we still need to make sure that production increases and that we make sure that medical professionals, health workers, community care workers, anyone working with potential COVID patients has the right personal protective equipment, which are masks, which are eye protection, which are gloves, which are gowns, which are respirators, in certain areas. So it is important that we still continue to do so. And I think that's really important.
Yeah, just to add on valves, because I think we have to remember that the world of masks was not designed for COVID. If you look at who wears masks in our community, very often it's frontline health workers, but it's also people working with hazardous materials,
right,
people working on construction sites. And very often those masks have valves, because you're not worried that the construction worker is going to give you a disease. What you're worried is that the construction worker is going to be exposed to a hazardous chemical, right, or something else that may, asbestos or something that may go in their lung. So the mask acts as a filter. As they breathe in through the filters that are in the mask. And as they breathe out, it's the valve that allows the air to breathe out. So it allows them to work very effectively because they can exhale very comfortably. And in doing that, they're not breaking the pressure seal on the mask. The mask stays perfectly fitted. So as you breathe in the air, the mask is very sealed and the seal improves. And then as you breathe out, you can break the seal on the mask because you put pressure on the mask. It acts like a parachute. And the beauty of the valve is that it allows you to exhale under exertion, but not break that seal. So it's a kind of a way of getting all the air out of the system. But that air that's coming out is from the worker. It's not necessarily filtered as well. So the danger is that if you wear a valved mask, you may actually, if you're infected, you may just be blowing infected aerosols. In other words, it defeats the purpose of wearing the mask. It's not dangerous for you, but it just defeats the purpose. Right. And I think that's the important thing about valve masks. And the same, and in general, if health workers are wearing valve masks, it's for the same reason. When health workers are wearing valved masks, if you're talking about working in an Ebola ward or somewhere like that, everyone in the Ebola ward has Ebola. It's the health workers who don't have Ebola. So what you want to make sure is they're as comfortable as possible. So there's been a lot of adaptation of masks from other areas into this space. And I think there will be a need as we go, and we are looking at this now, looking at innovation in protective gear. Yeah. Because I've seen in Ebola, I've worked in Ebola wards myself, I guarantee you spend a couple of hours in an Ebola ward at 110 degrees with Fahrenheit, yeah. Yes. But if you're doing that in a 100% humidity, and you're in a first layer of medical gear, and then you're on another layer of a jumpsuit, and then you've got a plastic cover over that, and then you've got a hermetically sealed mask, and you've got goggles, and you're in Wellingtons. I've come out of those wards literally with my Wellingtons full of water, which is sweat, and it's very hard to work in those environments. And you've seen the workers on TV with the PPE on. It's frightening for the patients, it's frightening for the workers, it reduces your capacity to work effectively. You see when you see so many different designs, no design is perfect. We haven't really come, I think, to a perfect combination of protective equipment. And equally, I think we'll have to look in the aftermath of this pandemic. And again, the innovation that's come from communities around fabric masks and people who've really become activists for that, we need to look at that as well. Around how we can learn from that kind of community-based innovation and react quickly to those movements that come up. I mean, we would have had a medical mask approach up to now. In other words, we'd have said we will wear masks or don't wear masks. maybe we underestimated the power of communities to make their own masks. You know, and I think that's something we need to look at in future.
It's really exploded.
Is grassroots PPE. So I think it's interesting. All of that's really interesting, but really important that people understand that the valve thing is not protecting. It's not protecting others.
Yeah.
Thank you very much. This was a great explanation. I think, Mike, you have another commitment in 1 minute, so we have 1 minute to close this discussion. I thank you very much for all your time, not just today, but throughout the year, and to all our viewers for watching us and for asking their questions. I can see that the positive energy is coming back, and that we're seeing more innovative solutions, whether it's on vaccines or on a medical side or on a community level, and other solutions on masks. So what is your closing message today, looking into those positive signs and solutions that are coming from all over the world?
It reminds me of the scene in Shrek, you know, where Donkey is in the back going, "Are we there yet?" You know, and how annoying that is, right? Well, I'd just like to say we're not there yet. We're nearly there, but we're not there yet. And we're going to have to be very patient with each other over the coming months. We've got to keep it up what we're doing now. There are lives that will be lost if we don't keep up what we're doing now. And then when the vaccine comes on stream and full, we'll be able to save more lives. But we need to save the lives we can now, not the lives we promise to save next year.
Yeah.
Don't promise to do something next year that you can do today. Keep yourself safe, keep everyone else safe, and then the vaccines will really make a difference.
Yeah.
The vaccines are not a replacement for good public health. They're a massive addition to the armory we need to defeat this virus.
Yeah, and I think it's a time to be hopeful. I mean, I think we can tell everyone, you know, our message is to be hopeful, but we have to put in the work. So this is not going to go away on its own. We need to, all of us, put in the work as individuals, as families, as communities, as leaders, and whether we're political leaders or religious leaders or youth leaders, all of us have to do the work. And one of the things we're trying to tell everyone everywhere is know what your risk is and take steps to lower that risk, because you have the power to do that. So everything that you can to prevent yourself from getting infected, to prevent you from passing it to someone else, do it now. Do it every day until we get through this, because we absolutely will get through this.
Thank you, Maria. Thank you, Mike. I think everyone needed to hear some signs of hope after this difficult year. We are coming to an end of the year, but we are not at the end of this pandemic. We are not there yet. Please stay with us, follow and all fine-tuned information on our social media channels, on our website. And until next week, please stay safe. All information you can also find at www.who.int. Thank you and goodbye.